Hello and welcome to our channel. Today, we have a topic that is both informative and crucial to everyone's health. We will delve into the world of cancer and discuss the specific blood tests needed for the most common cancers. Understanding these tests can be a vital step towards early detection and prevention. Cancer is a complex disease, and early detection plays a vital role in successful treatment. Understanding the right blood tests for different cancers is essential. Firstly, it is important to remember that there is no single universal blood test that can detect all cancers. Different cancers have different markers and therefore specific tests are needed. When it comes to blood tests, accuracy is key. Medical professionals rely on these tests to diagnose cancer, determine its stage and plan an effective treatment strategy. We start with breast cancer, the most common cancer among women worldwide. The primary blood test for breast cancer is the CA15-3 test, which measures the level of a protein called cancer antigen 15-3 in the blood. Increased levels could indicate the presence of breast cancer cells. For breast cancer, CA15-3 and CA27.29 tests are commonly used to monitor the progress of treatment. Most patients who develop breast cancer have no family history of the disease. There is, however, about 10% of breast cancers that have a hereditary component, meaning they are caused by a gene mutation inherited from the family. The best known genes that can be mutated and lead to increased risk are the BRCA1 and BRCA2 genes. These are suppressor genes that prevent tumor cells from growing. When mutations in these genes are inherited from one parent, there is a higher lifetime risk, compared to the general population average, of developing breast cancer, ovarian cancer or other hereditary cancers, prostate, pancreatic and melanoma. Older age is one of the factors that increases a person's risk of developing breast cancer, and according to American Cancer Society statistics, a woman's risk by age. Moving on to prostate cancer, a common cancer in men. The prostate-specific antigen, PSA, test is crucial for screening. Elevated PSA levels can indicate prostate problems, including cancer. It's important to note that an elevated PSA level does not necessarily mean cancer, but warrants further investigation. Normal PSA values are established according to age and fall within the following ranges. Free prostate-specific antigen, or free PSA, is the percentage ratio of free PSA detected to total PSA. Both tests are performed from the same serum, and the interpretation of the values is useful only in case of total PSA between 4 to 10 nanograms/ml. The test is not recommended for patients undergoing androgenic therapy, as it is necessary to inform the attending physician about the administration of such treatment and to consult him/her about the free PSA values obtained if it is decided to determine them anyway. Colorectal cancer, which affects the colon or rectum, is detected by the CEA, carcinoembryonic antigen, test. CEA is a protein marker, and its increased levels in the blood may indicate colorectal cancer. However, other factors can also cause elevated CEA levels, so further tests are needed for confirmation. Now, let's talk about lung cancer, a leading cause of cancer deaths. The blood test for lung cancer is the LDH, lactate dehydrogenase, test, which measures the level of the enzyme LDH in the blood. High LDH levels may suggest lung cancer, although further tests, such as imaging studies, are needed to confirm. For lung cancer, NSE, neuron-specific enolase, and CEA, carcinoembryonic antigen, tests are essential. Ovarian cancer, a silent killer among women, is difficult to detect in its early stages. The CA125 blood test measures CA125 protein levels, which can be elevated in ovarian cancer patients. However, this test is not reliable, and further imaging studies are often needed for a definitive diagnosis. Bladder cancer, common in older adults, is diagnosed using urine tests and cystoscopy. The NMP22 test measures a specific protein in the urine, indicating the presence of bladder cancer cells. Cystoscopy provides a direct view of the bladder, allowing doctors to detect abnormalities and potential cancerous growths. Skin cancer, including melanoma and non-melanoma types, is usually diagnosed by biopsy, in which a sample of suspicious skin tissue is examined under a microscope. Blood tests are not the primary method of diagnosing skin cancer, but may be used to assess overall health and the extent of the disease in some cases. Pancreatic cancer, known for its aggressive nature, is diagnosed through various tests, including blood tests, imaging studies and biopsies. The CA19-9 blood test measures the level of a specific antigen, which can be elevated in pancreatic cancer. However, it is essential to combine this with imaging techniques for an accurate diagnosis. Kidney cancer detected early has a greater chance of successful treatment. The Kidney Function Panel, a series of blood tests, helps assess kidney health. Elevated creatinine levels could indicate kidney problems, which could be caused by kidney cancer. Studies such as CT scans are then performed for further evaluation. Moving on, let's talk about hematological cancers such as leukemia and lymphoma. These cancers affect the blood and lymphatic system, making specific blood tests incredibly important. The CBC, Complete Blood Count, test is a fundamental diagnostic tool. It helps identify abnormalities in the blood, including the presence of cancer cells. In addition, there are specialized tests, such as flow cytometry, that can analyze individual cells in a blood sample. This technique is particularly useful in diagnosing different types of leukemia, providing detailed information about the specific cell markers present. Finally, liver cancer, often linked to underlying liver disease, can be diagnosed by blood tests such as alpha-fetoprotein (AFP) tests. Elevated AFP levels may suggest the presence of liver cancer cells. Liver imaging studies such as ultrasound and MRI are crucial for confirming the diagnosis and determining the extent of the disease. We understand that talking about cancer can be overwhelming, but knowledge empowers us. By being aware of specific blood tests for each type of cancer, individuals can take proactive steps toward their health. Regular screenings, awareness and early detection are our strongest allies in the fight against cancer. Remember, early detection is essential for successful treatment. If you or someone you know is at risk or showing symptoms, don't hesitate to consult a healthcare professional. This was our discussion of the blood tests needed for different cancers. We hope you found this information valuable and insightful. Remember, knowledge is a powerful tool, so share this video with your loved ones. Let's spread awareness and contribute together to a healthier world. If you have any questions or topics you'd like us to address, feel free to leave a comment below. Don't forget to like, share and subscribe for more informative content. Thanks for watching and stay healthy.